Okay? Let's talk about the ligaments of the female, no? Uterus. Okay? Favorite din itanong, no? So, first, your round ligament of the uterus, okay? It represents the remains of the lower part of the gubernaculum. Okay? Asaan siya dito? Round ligament of the uterus. Ayan. Okay? So, this is the lower part. It represents the remains of the lower part of the gubernaculum. Okay, remember na mention natin before, okay, it is a structure that passed through the inguinal canal, no? It enters the deep inguinal ring and exits the superficial inguinal ring, and eventually, okay, it becomes lost to the subcutaneous tissue of the labia majora. Okay, that is your round ligament of uterus. Your broad ligament, okay, it is two-layered folds of peritoneum, okay, located at the lateral margins of the uterus to the lateral pelvic walls. Okay, so it has several parts. Your mesovarium here, your yan, somewhere here, no? Your mesosalpinx and your mesometrium. Okay, actually this is the broad ligament. Yan. Yung parang pakpak, no, ng uterus mo. Okay? And you also have ovarian ligament. So this is the ovary. So this is the ovarian ligament, no? So it will extend from the ovary to the uterus, no? Just below the uterine tubes. Okay? So this is the ovarian ligament. Okay? And lastly, you have the suspensory ligament. Your suspensory ligament, okay, will extend from the ovary. So ayan, nandito siya. And it will attach to the pelvic wall. Okay? It is important because it contains the ovarian vessels, nerves, and lymphatics. Okay? So don't get confused. Okay? The ovarian ligaments, okay, are contained within the suspensory, no? Hindi sa ovarian ligament. Okay? Nililito pa tayo, no? Okay? Your ovarian vessels, okay, are within your suspensory ligament, not ovarian ligament. Okay? So, that's all about your pelvis. Okay? So, let's go to the perineum. Okay? Your perineum is a diamond-shaped space, no? Bounded by, okay, several structures. Anteriorly by the symphysis pubis, anterolaterally by the ischiopubic rami, okay, the tip of the coccyx posteriorly, laterally by the ischial tuberosities, posterolaterally by the sacrotuberous ligaments. Okay? The floor, okay, is served by the skin and fascia, and the roof is the pelvic diaphragm. Okay? So your perineum, diamond shape, okay, it is divided in the middle, no? So you have two triangles. Okay? So you will have an anterior triangle, okay, which is the urogenital triangle, and a posterior triangle, which is the anal triangle. Okay, so ayan, alamin natin muna yung picture. So this is the perineum, no, diamond-shaped space. Okay, ito bony landmarks. So anteriorly, symphysis pubis. Laterally, ischiopubic ramus, sacrotuberous ligament here. Okay, inferiorly, the tip of the coccyx. Okay, so if you draw a line between the two ischial tuberosities, you will have two triangles. So an anterior triangle, which is the urogenital triangle because it contains, no, the urogenital structures, and posteriorly you will have the anal triangle, no, because it contains the anus. Okay? So one important structure in your perineum is your pelvic diaphragm, okay, which is formed by your levator ani and coccygeus muscle. Okay, it is incomplete anteriorly and allows passage of the urethra in males and the urethra and vagina in females. Okay? So, we'll start first with your anal triangle, no? Sa likod muna tayo. Okay, so your anal triangle will contain your anus. Okay, so which is the lower opening of the anal canal. Okay, so the posterior triangle will contain the anus. Okay, and on each side, okay, you will have a space, okay, known as your ischiorectal fossa. Known as your ischiorectal fossa. Your anus, okay, the skin of the anus is supplied by inferior rectal nerve. Okay, and the lymph drainage is going to the medial group of superficial inguinal nodes. Okay? So, this is your posterior triangle. Ayan, this is your anus, no? On each side, meron kang ischianal fossa. Okay, so what are the features of your anal canal? First, you will have a dentate line or pectinate line. Okay, so it is a line that divides the anal canal into upper half and a lower half. Okay, you also have anal. I think na pag interchange ito, no? This should be anal columns. This is anal valves. Okay. So your anal columns, okay, are 5 to 10 longitudinal folds of mucosa. Okay, and each column will contain an artery and a vein. Okay, and inferiorly, you will have an anal valve, no, on each column. Okay, you will also have anal sinuses, okay, which are a series of pouch-like recesses at the lower end of the anal column where the glands open. Okay, so ayan, no, this is an anal column. Okay, inferiorly, you will have an anal valve. Okay, and then in between are anal sinuses. Okay? So, this is the dentate or pectinate line. Okay? So, above which is the upper half of anal canal and below is the lower half of anal canal. Okay? So, the structure that divides your anal canal into two, upper half and lower half, is the dentate line. Okay, you also have sphincters, no? The internal anal sphincter, which is involuntary, and an external anal sphincter, no, which is voluntary. Okay? And the line separating the two sphincters, okay, is your Hilton-White line. Okay, Hilton-White line, or it is an intermuscular or intersphincteric groove that separates the internal and external anal sphincter. Okay? So this is your anal canal. This is your internal anal sphincter. Okay? This is your external anal sphincter. Okay? So what are the differences, no, between your upper half and lower half? In terms of origin, okay, the origin of the upper half is just like the usual, no, GI tract, no? They are derived from the endoderm, okay? While your lower half of anal canal is derived from the ectoderm, okay? In terms of epithelium, okay, your upper half, okay, has columnar epithelium, while your lower half, okay, para na siyang normal skin, no? It is stratified squamous epithelium. Okay? The nerve supply, okay, your upper half, okay, para siyang GIT, no? It will be supplied by the autonomic plexus, while your lower half is supplied by somatic inferior rectal nerve. The upper half is only sensitive to stretch, okay? While your lower half will be sensitive to any type of sensation, no? Pain, temperature, touch, pressure. In terms of arterial supply and venous drainage, your upper half, okay, is supplied by your superior rectal artery coming from inferior mesenteric artery. While the lower half, okay, is supplied by inferior rectal artery and vein from the internal pudendal vessels. Your lymphatic drainage, okay, the upper half, okay, is going to the inferior mesenteric nodes, while your lower half is going to the medial group of superficial inguinal nodes. Okay? You can only see anal columns and anal valves in the upper half. Okay? In the upper half of the anal canal. Okay? And in terms of hemorrhoids, the upper half, okay, internal hemorrhoids. Pero if it's in the lower half, okay, it's external hemorrhoids. Okay? So as we mentioned, on the lateral parts of each of the anus, no, we can see the ischiorectal and ischioanal fossa. Okay? So it is a wedge-shaped space located on each side of the anal canal. Okay? And separated from the pelvis by the levator ani and its fascia. Okay? What's the clinical importance? No, it is a common site of abscess, no, that can extend, okay, by way of the communication over the anococcygeal raphe. Okay? So this is your anus, no? Sabi natin on each side you have ischioanal fossa. Okay? So your ischioanal or ischiorectal fossa. Okay? So it is bounded by, no, the base, ito ang base natin, skin. Okay? The medial wall is bounded by the levator ani, no, in your anal canal. Okay? So this is the levator ani and anal canal. Okay? That is the medial wall. While the lateral wall, okay, is formed by the obturator internus. Okay? You can see in the lateral wall, nandun ang pudendal canal, no? Or your Alcock's canal. Okay? Containing the pudendal vessels and nerves, no? Okay? So, ayan, as mentioned, the base is the skin. The medial wall is levator ani and anal canal. The lateral wall is obturator internus. Okay? And the contents include the ischoanal fat, inferior rectal nerves and vessels, the perineal branches of posterior cutaneous nerve of the thigh, and as described earlier, the pudendal canal, no, or your Alcock's canal. Okay? So that is your anal triangle. Okay? Now let's go to the urogenital triangle. Okay? So your urogenital triangle is further divided into two spaces. Your superficial perineal pouch or space and your deep perineal pouch or space. Okay? Your superficial perineal pouch is bounded by the membranous layer of superficial fascia. Okay? Below and above, okay, bounded by the urogenital diaphragm. While your deep perineal pouch is bounded by the superior and inferior fascia of the urogenital diaphragm. Okay? So this is your perineum. This is your anal triangle. This is your uh, urogenital triangle. Okay? So within your urogenital triangle, okay, that will contain the penis and the scrotum in males, while in females, it will contain the clitoris and the orifice of the urethra and the vagina. Okay? Internally, okay, the superficial perineal pouch, okay, so both in females and in males, okay, so they will contain the bulbus sponjosus, ischiocavernosus, superficial transverse perineal muscles, the perineal body, and the perineal branch of the pudendal nerve. Okay? Pero, no, one unique structure that we can see in the superficial perineal pouch in females are your Bartholin's glands or your greater vestibular glands. Okay? In the deep perineal pouch, okay, you can see parts of the urethra, the deep transverse perineal muscles, the internal pudendal vessels, and the dorsal nerves of clitoris. Okay? In males, you can also see the bulbourethral glands, no, in the deep perineal pouch. Okay? So that's the perineum, no? Okay, now, okay? We also have, let's discuss the blood vessels in your pelvis, okay? The most important ones is your internal iliac artery, okay? So it arises from the bifurcation of common iliac, okay, in front of the sacroiliac joint, okay? And it is crossed in front by the ureter at the pelvic brim. Okay, it has two divisions, an anterior and posterior division. Okay? So, ayan, no? So, this is your common iliac artery. Okay? This is your external iliac artery, which will supply the lower extremities. This is your internal iliac arteries, okay, with several branches. Okay, another picture, no? Internal iliac is here, okay, with several branches. Okay, this is the external iliac. Okay, my mnemonic here, okay, is ito yung mga branches, no, ng internal iliac. Actually, this is from the internet, no? Baka sabihin nyo bastos ako, no? Okay? The mnemonic is, I love going places in my very own underwear, no? I love going places in my very own underwear. Okay? I for iliolumbar, love for lateral sacral, going, okay, for superior gluteal and inferior gluteal, places for pudendal, internal pudendal specifically, okay, I for inferior gluteal and inferior vesical, my for middle rectal, very for vaginal, okay, yung own, O is for obturator, and U for uterine and umbilical. Okay? Yung first three, okay, are coming from the posterior division. Okay, your iliolumbar, lateral sacral, saka superior gluteal. Okay? Sila ay galing sa posterior division. Okay? So, yan. So iliolumbar will supply the psoas and quadratus lumborum. Your lateral sacral will supply the muscles and skin over the sacrum. While your superior gluteal, always remember it is the only structure that leaves the pelvis above the piriformis, no? Above the piriformis in the greater sciatic foramen. Only structure that leaves the pelvis through the greater sciatic foramen above, no? Above the pelvis, and it will supply the muscles of the buttocks. Your inferior gluteal artery, so the following pala, no? The following are branches of your anterior division of the internal iliac artery. So, ayan, no? So, your anterior division, okay, will be coming from your anterior division branches, no? First, inferior gluteal artery, okay? Ayan. So, internal pudendal artery, no? So, your internal pudendal artery, it will live through the greater sciatic foramen, pero babalik, no? And then it will enter the lesser sciatic foramen. Si internal pudendal hindi makapag-decide, no? Saan pupunta? Okay? It will live through the greater sciatic foramen and it will enter to the lesser sciatic foramen. Okay? Okay? Mangiiwan pero babalik. So, that's internal pudendal artery. Your umbilical artery, okay, has further branches, no? Superior vesical artery to supply the superior part of the bladder, and your artery to the ductus deferens, okay? And the distal part of your umbilical artery will become obliterated, no? To become your medial umbilical ligament. Your obturator artery to supply the muscle of the thigh and head of the femur, no? In children, it is the most important blood vessel, okay, to supply the head of the femur. Okay? You also have inferior vesical artery to supply the bladder, vaginal artery to supply the vagina. Okay? You also have middle rectal artery to supply the rectum and anus, anal canal, and a uterine artery to supply the uterus and cervix and vagina. Okay, now, so let's go to your sacral plexus. Okay? So your sacral plexus, again, no, it is formed by anterior rami pa din, no? Anterior rami, but this time it's L4 to S4. Okay? L4 to S4. Okay? It is formed in front of the piriformis. Okay? And remember, your lumbosacral trunk, okay, it is coming from your lumbar plexus, L4, L5. Okay? So your sacral plexus, so L4 to S4. Okay? So your remember, this is by threes, no? By threes. Okay? So L4, L5, S1, okay? It will form your superior gluteal nerve, which supplies your gluteus medius, gluteus minimus, and tensor fascia lata. Okay? Superior gluteal nerve. Your nerve to quadratus femoris, okay, on the other hand, will supply your, okay, of course, now your quadratus femoris and your inferior gemellus. Okay? Next, now your L5, S1, and S2, no, by threes nga, no? So L5, S1, S2. This time, it will form the inferior gluteal nerve, okay, which will supply the gluteus maximus, okay, and it will supply the nerve to obturator internus, okay, which will supply the obturator internus in your superior gemellus. Okay, next, no? S1, S2, S3, okay? These nerve roots will form your posterior cutaneous nerve of the thigh. Posterior cutaneous nerve of the thigh, so it will supply the posterior part of your thigh. Okay? And S2, S3, and S4, no? Your pudendal nerve. Okay? So S2, S3, S4, it will form your pudendal nerve. Okay? And L4, L5, S1, S2, S3, no? So this will form your sciatic nerve. Okay? It's the largest nerve in your body, which will eventually, okay, divide into two. Your tibial nerve and your common peroneal nerve. Okay? So this is the actual, no, actual lumbar plexus. Actually, lumbar plexus ito, no? Okay? Next, no? This was mentioned already, no? Your sciatic nerve. This is the largest branch of the sacral plexus, and it also happens to be the largest nerve in the body. Okay? Okay, some other details. Okay, na-mention ka na. Okay, your pudendal nerve, basta pudendal, sila yung hindi makapag-decide, no? It will leave the greater sciatic foramen and then it will enter through the lesser sciatic foramen. Okay? So that is the end of your pelvis and perineum and your sacral plexus. Okay? So now let's go to your upper extremities. Okay? So your upper extremities, okay? We will start with your clavicle. Okay? It is the bone that articulates with the sternum and first costal cartilage medially. Okay, so it will form the sternoclavicular joint here. Okay, and it will form the acromioclavicular joint. Okay, laterally. Okay, its function is to transmit forces from the upper limb to the axial skeleton. Okay, so there are differences, no, between the medial 2/3 and lateral thirds. Your medial 2/3 here, okay, is convex forward, no? Convex forward. While your lateral third is concave forward. Okay? So your clavicle happens to be the most commonly fractured bone in the body. Okay? With the mechanism, fall on the shoulder, no? So directly on the shoulder, or you can fall on outstretched hand. Okay? Outstretched hand. So, matatransmit ang forces, pupunta sa clavicle. Okay? Okay, the most commonly location of the fracture is in the junction of the middle and outer thirds. Okay, so this is the outer thirds. This is the middle third. Okay, so the fracture is usually the junction. So here, no? Anong napansin nyo dyan, no? Merong sudden change in curvature, no? So just like in fractures in any part of the body, okay, the fracture is usually at the portion na merong change in curvature, no? So doon nangyayari ang fractures. So your clavicle is the first bone to begin ossification and the last one, no, to complete ossification, no? So ang term natin, no, siya ang nauna, siya rin ang wakas, no? Siya ang naunang mag-ossify, siya rin ang wakas na mag-ossify. Okay? And your clavicle, okay, is the only long bone to be ossified intramembranously. Okay? Because as a rule, your long bones will ossify endochondral, no? Except your clavicle. Ang bumali ng rule, clavicle. Because it is a long bone that ossifies intramembranously. Okay? So now let's go to your scapula. Okay? Your scapula is a flat triangular bone. Okay? Let's go directly now to the picture. Okay? So this is your scapula, triangular. So you have a spine. Okay? This is the spine of the scapula, continuous with your acromion. Okay? Acromion here, laterally. Okay? You also have a glenoid cavity, okay, which will articulate with your humerus, now to form your glenohumeral joint or your shoulder joint. Okay? You also have a coracoid process, okay, which is the origin of the short head of the biceps brachii. Origin din siya ng coracobrachialis. Okay, and insertion ng pectoralis minor. Okay? Okay? So, ayan. Let's go directly to the picture, no? So, you have a supraglenoid tubercle. So, this is the glenoid cavity, no? So, the edge above is the supraglenoid tubercle. Okay? Below is the infraglenoid tubercle. Okay? In here, you have a suprascapular notch. Okay? It is converted into a tunnel by the transverse scapular ligament. Transverse scapular ligament. Okay? So, magiging tunnel siya to allow passage of, walaan nyo, no? Suprascapular nerve. Okay? So, pag may mga tumor dyan, nako-compress si suprascapular nerve dyan. Okay? You also have subscapular fossa. Okay? Here, malalaman mong anterior siya pag wala siyang hati, no? Posterior pag may hati. Okay? So, this is the subscapular fossa, the anterior part of your scapula. Okay? This is the supraspinous fossa, kasi above the spine. This is the infraspinous fossa, below the spine. Okay? So, you have the shoulder joint, no? So, the first joint that we will discuss is the shoulder joint. Okay? It is the articulation between the head of the humerus and the glenoid cavity, no? As you can see, hindi siya perfect fit, no, for each other. Okay? That's why you have a glenoid labrum. Okay? Your glenoid labrum improves the fit of your shoulder joint. Okay? So, it deepens the glenoid cavity para masalo niya yung head of the humerus. It is a synovial ball and socket joint, no? So, meron kang flexion, extension, abduction, adduction, and internal-external rotation. Okay? Majority, okay, of the stability and strength of the shoulder joint is dependent on the rotator cuff. Okay? That's why, important, no? Na preserve natin yung rotator cuff. Okay? So, in here, you can see this is the shoulder joint, no? Protected by several ligaments. Okay? As you can see, inferiorly, wala ka masyadong mga structures, no? Wala ka masyadong ligaments inferiorly, no? That's why the most common location or the most common direction for shoulder dislocation is inferior. Okay? Better if antero-inferior. Okay? Or if isa lang ang choice, inferior, no? So, your shoulder joint is the most commonly dislocated large joint. Okay? So, inferior ang common location on this direction because wala tayong masyadong support inferiorly. Okay? And usually, pag nagkaroon ka ng inferior shoulder dislocation, there will be damage, okay, of the axillary nerve and the posterior humeral circumflex vessels, no? Because they are the structures located inferiorly, no, in the quadrangular space. So, yan ang mga nai-injure. Okay? So, this is the normal, okay? Normal anatomy of the shoulder. Okay? So, what happens? Ayan. Pag meron kang shoulder dislocation, antero-inferior. Okay? Antero-inferior. Okay, next. Your sternoclavicular joint. Okay? It is the articulation between the sternal end of the clavicle and the manubrium together with the first costal cartilage. So, it's here. Sternoclavicular joint, no? So, clavicle, manubrium, and your first costal cartilage. Okay? So, it is a synovial double plane joint. Okay? Other references says it's a saddle joint. Okay? So, but in Snell, we will follow Snell, no? Synovial double plane joint. Next, your acromioclavicular joint, okay, is an articulation between your acromion and your clavicle. It is a synovial plane joint lang, no? So, gliding movements lang ang meron tayo dyan. Gliding movements. Okay? So, next, okay, you have your humerus. Okay, you have a head. Okay, approximately 1/3 of a sphere, no? Kaya nga hindi perfect fit ang glenoid. Saka ang humeral head, no? So, this part articulates with the glenoid cavity. Okay? Go to the picture na lang tayo. Okay? So, you have immediately below the head is the neck, no? Anatomical neck. Okay? However, you also have another neck, no? Dalawa ang neck niya. Okay? You have a surgical neck here. Okay? Kaya siya surgical neck because this is the common site of fractures, no? Okay? This is the common site of fractures. Okay? The surgical neck. Okay? You also have a greater tuberosity or greater tubercle and a lesser tuberosity or lesser tubercle. Okay? In between them, okay, in between the two tubercles, okay, is the intertubercular groove or intertubercular sulcus or your bicipital groove. Okay? Same lang yon. Okay? So, kaya siya bicipital groove, it allows the passage of the biceps tendon. Okay? So, yan. Okay? Next, no? You also have a deltoid tuberosity. Okay? A deltoid tuberosity which serves as the insertion of your deltoid muscle. Okay? And a spiral groove, no? It is a groove for your radial nerve. Okay? Yung ibang references, radial groove yan. Okay? It is a common site for radial nerve injury, no? Ang tawag doon, honeymooner's palsy. Tama? Honeymooner's palsy, no? So, pag nakakahiga, pag yung jowa mo humiga dyan, no? sa arm mo, no? Ipet si radial nerve sa shaft. Okay? Sa shaft ng humerus. Okay? So, sa spiral groove yon. Okay? Sometimes, no, pag mayroong fractures ng humerus, shaft of humerus, okay, siya rin yung nai-injure, no? Si radial nerve at the spiral groove. So, fractures of shaft of humerus, radial nerve pa din. Okay? So, in here, this is your deltoid tuberosity, no? Insertion of your deltoid muscle. Okay, next, your humerus, okay? At the distal part, no, you have, okay, picture na lang, no? You have a medial and lateral epicondyle. This is the lateral epicondyle, the common origin of your wrist extensors, no? Common origin of wrist extensors. While your medial epicondyle, the common origin of your wrist flexors. Okay? You have a rounded structure here, the capitulum, which articulates with the head of the radius. Okay? And you have the trochlea, okay, which articulates with the trochlear notch of ulna. Okay? So, it is pulley shaped. Okay? So, next, okay? Sa picture na lang, no? You have a radial fossa here, okay? So, your radial fossa, okay, it will receive the head of the radius when the elbow is flexed, no? So, pag nag-flex ka, yung head of radius mapupunta dito, okay? While your coronoid fossa, it will receive the coronoid process of ulna when the elbow is flexed, okay? So, pupunta yung coronoid process here, no? Sa coronoid fossa. Okay? When the elbow is flexed. However, when the elbow is extended naman, okay, your olecranon process of ulna will be in contact with the olecranon fossa of humerus. Okay? When the elbow is extended. Okay? So, this is the whole picture of your humerus. Okay? So, let's go to your radius. Okay? Your radius is the lateral bone of the forearm. This is the lateral bone of the forearm. It has a head. Okay? The head will articulate with the capitulum and the radial notch of ulna. It has a neck. Okay? And a bicipital tuberosity. No? Bicipital kasi it is the insertion of the biceps brachii muscle. Okay? And it has a shaft. No? Okay? Medially, it has an interosseous border to allow attachment of your interosseous membrane. Okay? At a styloid process distally. Okay? And an ulnar notch at your... Okay? Ang ulnar notch, remember, the ulnar notch is in the radius. Okay? So, it will receive the head of ulna. So, the ulnar notch is in the radius. Okay? And it also has a tubercle, no? Parang pulley siya for the tendon of extensor pollicis longus. Okay? So, this is the radius. This is the radial head. Okay, mag-articulate with the radial notch of ulna. Okay, this is the neck. Okay, the radial or bicipital tuberosity, no? Insertion ng biceps, brachii. This is the shaft. Okay, and the interosseous border. Ayan, to allow attachment ng interosseous membrane. Okay, you have a styloid process. Okay, and then, nandito yung ulnar notch of radius, no? Which will receive the head of ulna. Okay, your ulna, on the other hand, is the medial bone of the forearm. Okay, the medial bone of the forearm. So, you have olecranon process, no? So, palpable siya dito, no? It forms the prominence of the elbow. Okay, forms the prominence of the elbow. You have a trochlear notch. Okay, a coronoid process. Okay, and remember, no, on the radial notch is seen on the ulna. Okay, radial notch is a feature of the ulna. Okay, so asan siya? Ito ang olecranon process. Okay, you have a trochlear notch. Okay, and the coronoid process. So this is the shaft. Okay, meron din siyang interosseous border. Okay, the head of the ulna is here, no? The head of the ulna is here. Okay? Oh, and yung radial notch is found in the ulna, no? To receive the head of the radius. Okay? So, ayan. Okay? Okay, so next, no? So, your elbow joint, okay, is formed by the articulation of what, no? Of the capitulum with the head of radius, okay, and the trochlea and the trochlear notch, no, of ulna. Okay, so that will form your elbow joint. It is a synovial hinge joint, no? Synovial hinge joint, meaning only flexion, extension lang, no? Ang movements natin dyan. Flexion and extension. Okay? You also have a superior radioulnar joint or proximal radioulnar joint. Okay? It articulates, the articulation is between the head of radius and the radial notch of ulna. Okay? It is a synovial pivot joint. Okay? Meaning to say, rotation lang, no? Pivot lang. Rotation lang ang movement natin dyan. Okay? That is pronation, supination. Pronation, supination. Your inferior radioulnar joint, on the other hand, is an articulation between the head of ulna and the ulnar notch of radius. It is a synovial pivot joint as well. So, pronation, supination lang. Okay? Okay, so let's go to the carpal bones. Okay, so your carpal bones, okay, so from proximal to distal, lateral to medial, our mnemonic is, I'm sure alam nyo to, no? Some lovers try positions that they cannot handle. So, some lovers try positions that they cannot handle. Okay, so scaphoid, lunate, triquetrum or triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Okay, baka malito dito, no? Alphabetical lang. Mauuna si trapezium bago si trapezoid. Alphabetical. Okay, so in picture, this is the proximal row. This is the distal row. Okay, so scaphoid, lunate, triquetrum, okay, with pisiform on top. Okay, and then trapezium, capitate, hamate, yun lang. Okay? So, another picture, closer. Scaphoid, lunate, triquetrum, okay, or pisiform on top. So, trapezium muna bago trapezoid, capitate, and hamate. Okay? So, the largest is your capitate. No? Largest carpal bone. Okay. So, in your wrist, okay, we have an important structure, no? A membranous structure in your wrist, okay, known as the flexor retinaculum. So, it bridges the lateral and medial edges of the carpals, no? And what's important here is that it forms a tunnel, no? Known as the carpal tunnel that allows passage of your median nerve in the flexor tendons of the finger. So, pag na-injure si median nerve dyan, ang tawag natin, carpal tunnel syndrome. Okay? So, this is your flexor retinaculum, no? It allows passage of the flexor tendons, no? Such as flexor pollicis longus, flexor digitorum superficialis, flexor digitorum profundus. Okay, and the important nerve here in your carpal tunnel is your median nerve. Okay? So your metacarpals, okay, you only have 5 metacarpals on each hand. Okay? It is composed of a base, a shaft, and a head. Okay? So the base is the proximal part which will articulate with the carpals, while the head is the distal part which will articulate with the phalanges. Okay? So these are your carpals. Okay? The yellow ones are your metacarpals. So there are only 5. 1, 2, 3, 4, 5. Okay? So these will be the base. Okay? This is the shafts. Okay? So this will be the heads. Okay? It will form your knuckles. Okay? While your phalanges, you have 14 phalanges. Okay? Your 14 phalanges, you have 3 in each finger and 2 for the thumb. Okay? 3 in each finger and 2 for the thumb. Okay? So, same features just like your metacarpals. It also has a base, a shaft, and a head. Okay, so going back, these are the phalanges. So, you have 3 in each finger, only 2 for the thumb. Okay, so 3, 6, 9, 12, 13, 14. You only have 14 phalanges. Okay? So, now let's go to your wrist joint. Okay? So, your wrist joint is formed by the articulation between your distal radius, the triangular fibrocartilaginous complex, the scaphoid, lunate, and the triquetrum. Okay? So, the radius in your proximal carpal bones, no? However, your pisiform does not participate. Your pisiform does not participate in your articulation, okay, of the wrist joint. Okay? It is a synovial condyloid joint, so flexion, extension, abduction, adduction. Okay? Ang movements natin. Your carpometacarpal joint, okay, is unique, no? Because the first one, so your thumb, the first CMC joint is a saddle joint, synovial saddle joint. While the rest, the second to fourth are synovial gliding joints. Okay, the second to fourth are synovial gliding joints. Okay, your metacarpophalangeal joints, so articulation between the metacarpals and the phalanx, okay, proximal phalanx, these are synovial condyloid joints. Okay, while your interphalangeal joint, okay, is articulation between the phalanges, okay, proximal and middle, and your distal and middle phalanges. Okay, so these are synovial hinge joints. Okay. Okay, so now let's go, okay, to the most important plexus of your body. Okay, for me, among all the plexuses, no, ito yung kaya nating i-drawing, no? So I will teach you how. I hope you get it, no? Ating drawing. Okay? So your brachial plexus, okay, is formed by the anterior rami of C5 to T1. C5 to T1. Okay? It is formed in the posterior triangle of the neck. Okay? So you have C5, C6, C7, C8, T1. Okay? And each nerve, in each level, it will give a nerve root. Tama, no? A nerve root. Okay? So meron silang tig-isa. Okay. So dyan pa lang sa mga roots, meron mga nerves na na-form na. Okay? So dalawa. You have a dorsal scapular nerve. Okay? Dorsal scapular nerve which will supply the rhomboids, elevator scapula. And you also have the long thoracic nerve which will supply the serratus anterior. Okay? So sa C5 nerve root, dorsal scapular nerve. C5, C6, C7 nerve roots, the long thoracic nerve. Okay? So now, from the roots, magjo-join si C5, C6 root to form the upper trunk. Okay? Si C7, soloista. Okay? So solo siya sa middle trunk. Okay? While your C8 and T1, okay, will form the lower trunk. Okay, try to draw ha. Sabayan nyo ako. Okay, so C8T1 will form the lower trunk. Okay, so pag tinanong kita, which nerve roots form the upper trunk? Okay, so C5, C6. Which nerve roots form the middle trunk? C7. Which nerve roots form the lower trunk? C8, T1. Okay? So from each trunk, okay, sa upper trunk may mga nerves na mapo-form, no? Your nerve to subclavius, okay? Nerve to subclavius. Okay, hulaan nyo kung anong sinusupply, no? So, subclavius muscle. And your suprascapular nerve, which will supply the infra and supraspinatus. Okay? And then, each trunk will give off an anterior and posterior division. Okay? Each trunk will give an anterior and posterior division. Okay? So, yung A and P. Okay? Okay, so next, okay? Yung lahat ng posterior division, magsasama-sama. Okay? Yung anterior division sa taas, silang dalawa magsasama. Okay? While your anterior division sa ibaba, solo lang siya. Okay? So, dyan mabubuo ang ating mga chords. Okay? So, your lateral chords, okay, so dito sila galing. You will have a posterior chord formed by the posterior divisions. And you have a medial chord. Okay? So now, okay? So each chord will give off branches. Okay? So first, sa lateral chord, you will have a lateral pectoral nerve, okay, which will supply pectoralis major. You have a lateral root of median nerve, okay? So it will combine with the medial root of the median nerve, no, to form your median nerve. You also have a musculocutaneous nerve which will supply yung mga biceps, brachialis, no? Coracobrachialis. Ayan, sila mga yan. Okay, so lahat sila galing from lateral cord. While your posterior cord, okay, it will give off, okay, the branches, ang mnemonic, ultra, no? Ultra. Okay, upper and lower subscapular nerve, no? Which will supply the subscapularis. You also have the thoracodorsal nerve. It will supply the latissimus dorsi. Okay? Your radial nerve, which will supply, no, the posterior compartment of the arm and the forearm. Okay? And your axillary nerve, which will supply the teres minor and deltoid. Okay? And lastly, your medial cord, okay, which will give off a medial pectoral nerve. So it will supply the pectoralis major and minor. So medial cutaneous nerve of the arm. So it will supply the medial part of the arm. The medial cutaneous nerve of the forearm. Okay? And yung medial root will join the lateral root, the median nerve. Okay? And you will have an ulnar nerve. Okay? Kung ayaw nyo yung drawing ko, ayan na lang. Okay? Ayan. Okay? Or this is the actual, no? Actual brachial plexus, no? Other side naman, no? Right side. Okay? So your brachial plexus, okay, can be injured, no? And there are two types. Okay? You have an Herb-Duchenne palsy and you have and a Klumpke palsy. Your Herb-Duchenne palsy is a lesion in the upper trunk C5, C6, no? So what's the mechanism? Excessive displacement of the head to the opposite side, ganyan. Okay? And then, combined with the depression of the shoulder on the same side. So, ayan. So, mai-stretch yung brachial plexus mo there. Okay? So, anong mechanisms? Pag ikaw ay merong difficult delivery, no? Pag ikaw ay nagde-deliver, di ba, ng anterior shoulder ng baby, pag NSD, ginaganyan nyo siya, no? Ayan. So, pwedeng ma-injure doon. Or blow to or fall on the shoulder. Okay? So, pag mga contact sports, ayan, mga football, di ba? Okay? Madalas sila maganyan. Okay? So, eventually, the presentation is a waiter's tip deformity, no? Because nawala ng supply yung mga nerves or yung mga muscles na supplied by your upper trunk. Okay? So, ganyan ang itsura nila, no? Waiter's tip, para kang humihingi ng tip sa customer, no? Nang hindi mo pinapaalam na tinatago mo, no? So, internally rotated, pronated, the wrist is flex, no? Fingers flex. Okay? Your Klumpke palsy, on the other hand, is a lesion in your lower brachial plexus. Okay? C8 to T1. Okay? The mechanism is excessive abduction, cervical rib, okay? Malignant metastasis from the lungs, okay? And it will affect all muscles of the hand, okay? All muscles of the hand. Okay? And eventually will cause clawing, no? Kasi affected ang intrinsic muscles of the hand. Okay? So, ayan ang mechanism, no? Excessive abduction, okay? Or difficult delivery. Ayan, shoulder presentation ata yan, okay? And clawing of the hand, okay? So, that is your upper extremities. Okay, now, so after the upper extremities, we'll go to the lower extremities, okay? So, your femur, no? So, your femur is the longest, no? And strongest bone of the body. Okay? So, longest and strongest bone of the body. Okay? I will go direct to the picture na lang, no? So, you have a head, okay? You have a head, okay? So, that is hemispheric in shape, and it will articulate with your acetabulum, no? In your head, you have a fovea capitis, no? Fovea capitis, no? So, your fovea capitis is a small depression in the center of the head. Okay? And it will allow attachment of the ligament of the head of the femur. Ang haba, no? The ligament of the head of the femur. Okay? It is important because it conveys, no, the blood supply to the head. Okay? Specifically, your obturator artery, which is very important in children. Okay? You also have a head, okay? A neck, sorry, in here. Okay? So, the head, the fovea capitis, and a neck. Okay? You also have a greater and lesser trochanter. Greater and lesser trochanter. Anteriorly, it is connected by intertrochanteric line. Okay? Posteriorly, it is connected by intertrochanteric crest. Okay? Crest, no? Posteriorly. You also have a quadrate tubercle. Okay? Wala ata dito, no? Your quadrate tubercle, which is an insertion of your quadratus femoris. Okay? You also have a shaft, okay? And a linea aspera. Okay? Linea aspera. Okay? Which is a ridge on the posterior shaft. Okay? Important because it is origin ata no, ng hamstrings. Okay? So, your linea aspera is continued inferiorly with the medial and lateral supracondylar ridge. Okay? So, posteriorly daw, ito, no, ang linea aspera, continuous with the medial and lateral supracondylar ridge. Okay? You also have adductor tubercle, no? Here, no? Which is attachment for your adductor magnus. Okay? And then, you also have a gluteal tuberosity, no? A gluteal tuberosity in here, no? Insertion of your gluteus maximus. Okay? And then, a popliteal surface, okay, in here, no? A space for your popliteal fossa. Okay? You also have a medial condyle, a lateral condyle. Okay? So, yan yung mag-articulate sa knee joint, sa knees, or sa fibula, and, sorry, sa tibia. Tibia pala. Okay? And in between, meron kang intercondylar notch. Okay? So, you also have a bone anteriorly, no? Anterior to your femur, no? Which is a sesamoid bone. Okay? That is known as your patella. Okay? It is the largest sesamoid bone. Okay? When we say sesamoid, okay, it is a bone form that develops within a tendon. So, through friction, na-form yung bone na iyan. Okay? So, it lies within the tendon of the quadriceps in front of the knee joint. Triangular in shape. Okay? So, ang nangyari dyan, okay, this is your quadriceps. Okay? It is attached to the patella through your quadriceps tendon. It is here, no? So, this is the patella. And then, your patella, okay, is attached to your tibial tuberosity through your patellar tendon or ligamentum patellae. Okay? It will articulate with the condyles of the femur, no, to form your patellofemoral joint. Okay, patellofemoral joint. Okay, next, no, your tibia. Okay, your tibia, okay, it is the larger bone, larger leg bone. It is the weight-bearing bone. Okay, and it is the medial bone of the leg. Okay, larger, it is the weight-bearing in the medial bone. Okay, you also have lateral medial condyles in your tibia, okay, which will articulate with the lateral and medial condyles, no, of your femur to form your knee joint. Okay, you have intercondylar eminences, no, which are the attachment of your cruciate ligament. Your cruciate ligaments. Okay? You also have a tibial tuberosity, no, as mentioned, the attachment of the patellar ligament. Okay, and your tibia will form the medial malleolus. Okay, so this is your tibia, larger medial bone. Okay, we have two condyles, lateral and medial. Yan, and medial intercondylar eminence, attachment yan ng cruciates. Yan, this is the shaft and the medial malleolus. Okay? Your fibula, it is a non-weight-bearing bone, no? Or little to no weight-bearing lang yan. Okay? Anong purpose niya? Ba't siya nandyan, no? Okay? It can provide attachment, no? For your muscles. Okay? And it does not participate in the articulation of your knee joint. Okay? So, it has a head, a styloid process, a shaft, and a lateral malleolus. So, this is your fibula. Okay? So, this is the head. Okay? This is the shaft. Okay? And the lateral malleolus. Okay? Okay? So, one feature or one fossa in your lower extremity that we need to discuss is your popliteal fossa. Okay? This was recently asked. Okay? So, your popliteal fossa, okay, it is diamond in shape. Okay? Diamond in shape, okay, and situated at the back of the knee. Okay? And best palpated when you flex your knee joint. Okay? So, what is its importance, no? It will contain your popliteal vessels, the small saphenous vein, the common peroneal and tibial nerves, the posterior cutaneous nerve of the thigh, okay, and the genicular branch of the obturator nerve and some connective tissue and lymph nodes. Okay, so this is your popliteal fossa. Okay, so what are the boundaries? Okay, so perolateral here, okay, this is your biceps femoris. Okay, inferolateral, this is your lateral head of gastrocs. Okay, and sometimes if you have one, okay, plantaris, no, is also a boundary inferolaterally. So peromedial, the semimembranosus and semitendinosus. Inferomedial is the medial head of the gastrocs. So you now have a diamond. Okay? So the floor is formed by the popliteal surface of the femur, so sa ilalim, and the posterior ligament of the knee joint and the popliteus muscle. Okay? The roof is formed by the skin, superficial fascia, and deep fascia. Okay? So this is your popliteal fossa. Okay? So this is a simpler picture, no? A diamond shape. Okay? The contents, ayan. Popliteal vessels, andyan. Posterior femoral cutaneous nerve. The branches of the sciatic nerve, which is the tibial and the common fibular nerve, no? So, andyan sila. Okay? So now, okay, we are already at the tarsals, no? So your tarsals, you have 1, 2, 3, 4. You have 7 in total, no? So the largest of which and the strongest, no, is the calcaneum, no? Because it is the one that forms the heel, no? Kailangan strong ang heel mo, no? Kasi yan yung in contact with the ground, no? Most of the time. One feature of your calcaneus is a sustentaculum tali, no? Which is a shelf-like ridge, no? Kaya siya sustentaculum tali, sustentaculum, no? Parang sustento. It will support what, no? It will support your talus, no? So it will support your talus, okay? And this is a feature of your calcaneum or calcaneus. Your talus has a head, a neck, and a body. Okay? The head serves as the keystone of the medial longitudinal arch. Okay? Your talus has no muscle attachment, no? So sana all, 'di ba, hindi na-attach, tama ba? Okay? So your talus, no? Hindi na-attach. No muscle attachment. So this is your talus. This is your talus. This is your calcaneus, okay, which form the heel. Okay? You also have a cuboid, okay? The cuboid, wala namang masyadong important, no? But it has a groove for peroneus longus. Your cuneiform, okay? You have 3, no? You have 3 which are important for the formation ng transverse arch of the foot, okay? And your navicular, okay, which is a boat-shaped bone. Boat-shaped bone, okay? So, this is your navicular. Ayan, parang boat. You have 3 cuneiforms, the medial, intermediate, and the lateral, okay? And you have the cuboid. Okay? So, let's go to the joints, okay? So, your hip joint is an articulation of the head of the femur and acetabulum. If compared to your shoulder joint, better ang fit, no, ng hip joint, no? Because it requires stability, no? Pag tumatayo ka, kailangan stable ang hip joint. Kaya better dapat ang fit, no, ng femur and acetabulum. Okay? However, meron pa rin siyang palaman, no? Meron pa lang palaman ang hip joint, okay? Which is your acetabular labrum. Okay? Your acetabulum is horseshoe in shape, okay? And it is deficient inferiorly at the acetabular notch. Okay? Mamaya ko explain, no? And your hip joint is a synovial ball and socket, no? Analogous to your shoulder joint. Okay? So this is your acetabulum, sabi natin horseshoe in shape, no? Okay? Deficient inferiorly. Okay? Ang tawag dyan, acetabular notch. Okay? Later we'll know that there will be a ligament here that will form your notch into a tunnel. Okay? So this is your hip joint, no? Articulation between the femoral head and the acetabulum. Okay? Let's go to the ligaments of the hip, no? This one, medyo marami nang natanong, no? In this part of the hip, no? The ligaments, okay? So you have several ligaments, okay? To start with, you have iliofemoral ligament, okay? Or your Y ligament of Bigelow, okay? In general, all ligaments of the hip will prevent extension. Okay? All ligaments of the hip will prevent extension. Okay? This is the strongest ligament of the body. In fact, you can you can stand, okay, without muscle activity, no? Just by using your iliofemoral ligament. Okay? So your iliofemoral ligament will resist hyperextension and lateral rotation. Hyperextension and lateral rotation. While your pubofemoral ligament, okay, it is triangular in shape. Okay? Again, it will limit extension. Okay? Additional, it will limit abduction and external rotation. No? Kasi yung pubis, di ba, nasa ilalim siya, no? So, pag may ligament doon, it will limit abduction, no? It will limit upward movement of the femur. Okay? While your ischiofemoral ligament, spiral in shape, no? So, sa likod siya nanggagaling. Okay? And then, iikot siya papuntang harap. Okay? This time, it will limit extension and medial rotation. Okay? So, how do they look like? Ito, no? Your iliofemoral, parang Y, no? Y ligament of Bigelow. Okay? Your pubofemoral, okay? Ito, no? Nandito siya sa ilalim, no? So, imagine, it will limit abduction, no? So, hindi mo mabubukaka yung hip mo. Okay? While your ischiofemoral ligament, from anterior, it will go, from posterior, it will go anterior. Spiral shape, no? Okay? So, parang dalawa sa mga, dalawa dito parang tinanong na, no? Dalawa sa ligament of the hip. Okay? Next, no? Your transverse acetabular ligament. Okay? If you remember, a while ago, we have acetabular notch. Okay? This ligament, the transverse acetabular ligament, will convert the notch into a tunnel. Okay? To allow blood vessels and nerves, no, to enter the joint. Okay? While your ligament of the head of the femur, it is a flat triangular ligament, okay, which functions to slightly limit adduction of the hip joint. Okay? So, this is your ligament of the head of the femur. Okay? Hindi kita dito, no, yung transverse acetabular ligament. Okay? So, those are the ligaments of your hip. Okay? Okay, next, no? Your knee joint, okay, your knee joint is articulation between the femoral condyles and your tibial condyles, okay, with the intervening meniscus, no? With the intervening meniscus. Okay? Your tibia femoral, so this is the articulation between the femoral condyles and tibial condyles. It is a synovial hinge joint. Okay? While your patellofemoral, it is also part of your knee joint, no? Anteriorly. The patella and the femur, no? This time, this is a synovial gliding joint. Okay? So, sliding movements lang ang meron dyan. Okay? Okay. Okay. Now, let's talk about the ligaments, no, of the knee. No? We'll just highlight the intracapsular ligaments. Okay? Specifically, the cruciate ligaments. Okay? So, your cruciate ligament, you have two. Anterior and posterior cruciate ligament. Okay? So, your anterior cruciate ligament, it is attached to the anterior intercondylar area of the tibia. Kaya siya, anterior cruciate, no? While your posterior cruciate, ano siya sa posterior intercondylar area. Okay? So, your anterior cruciate, okay, nasa anterior siya, okay? From the tibia, it will go up to the femur, okay? At dahil nasa anterior na siya, it will go back posteriorly and laterally to be attached to the lateral femoral condyle. Okay? On the other hand, okay, your posterior cruciate, nasa posterior, no? It will still go up, okay, upward, okay? However, it will go forward na, no? Kasi nasa posterior na siya. Okay? And medially to be attached to the medial femoral condyle. Okay? Your anterior cruciate is taut during knee extension and it is lax during knee flexion. Okay? Taut during knee extension and lax during knee flexion. Okay? Hence, it will prevent hyperextension of the knee joint. Okay? That's why pag nag-hyperextend ang knee joint, okay, doon actually, no, nasisira or natitear ang anterior cruciate ligament. Okay? So, it also prevents forward sliding of tibia on the femur or the other way around, no? Posterior displacement of the femur on the tibia. Okay? So, basically, posterior cruciate ligament is the exact opposite of everything, no? Opposite. It is taut during flexion, lax during extension. Okay? So, another important structure in your knee is your meniscus. Okay? This is a C-shaped sheet of fibrocartilage. Okay? And acts to deepen the articular surfaces of the tibial condyles. Okay? Which will receive your femoral condyles. Okay? The medial meniscus is more susceptible to injury, no? Why, no? Kasi marami siyang attachment. 'Di ba ganoon naman, no, sa buhay? Pag attach ka, ikaw yung nasasaktan. Tama ba? Okay, so your medial meniscus, attached siya sa medial collateral ligament, okay? Saka sa anterior cruciate ligament. Kaya silang tatlo ang nasasaktan, tama? Okay? So actually that's the terrible triad, no? Terrible triad injury of the knee. Medial meniscal injury, MCL tear, okay, and your ACL tear, no? So, ayan, okay? Attach kasi si medial meniscus doon sa medial collateral ligament. So, hindi siya masyadong makagalaw. Nasasakal siya, okay? So, ayan. Pag nasira, yung isa, nasira din lahat. Okay? In your ankle joint, okay, it is articulation between the lower end of tibia and malleoli, together with the talus. Okay? Other name is talocrural joint. Okay? It is a synovial hinge joint. Okay? Plantar flexion, dorsiflexion lang ang movements dyan. Okay? So, this is your ankle joint. Tibia and talus. Okay. Medyo marami tayong intertarsal joint. Okay? But as a rule, Your intertarsal joints are all synovial gliding joints. Okay? They are all synovial gliding joints except the talocalcaneonavicular joint, which is a synovial ball and socket joint, and a calcaneo in the cubideo navicular joint, which is a fibrous joint. Okay. Again, all intertarsal joints are synovial gliding except the talocalcaneonavicular joint, which is synovial ball and socket, okay, and the cubideo-navicular joint, which is a fibrous joint. Okay, now let's go to the important artery in your lower extremity, your femoral artery. Okay? Your femoral artery is a continuation of your external iliac artery. So this is the aorta. This is the common iliac. Okay? Your common iliac will continue as the external iliac. Okay? And then your external iliac will become your femoral artery once it passed behind the inguinal ligament. Okay? So you can palpate your femoral artery between your ascis and your symphysis pubis. So your femoral artery, marami itong pinagdadaanan, no? Marami siyang pinagdadaanan kung saan sumusuot ang femoral artery. So first, okay, your femoral artery can be found in your femoral triangle. Okay, so your femoral triangle, okay, the base is inguinal ligament. Okay, ito. The lateral is the sartorius. And the medial part is the adductor longus. Ito, adductor longus. So you have a triangle. So the contents of the triangle, okay, is, ang mnemonic is navel. Navel, no? So nerve, femoral nerve, femoral artery, femoral vein, okay? And then you have an empty space, okay, followed by the lymphatic vessels or inguinal lymph nodes. Okay, again, femoral triangle contains navel, nerve, artery, vein, an empty space, and your inguinal lymph nodes. Okay? So, yan ang unang pinagdaanan ng iyong femoral artery. Okay? So, within the triangle, okay, meron pang femoral sheath. Okay? So, ang nangyari dito sa femoral sheath, okay, hindi sinali si femoral nerve, no? Ang femoral sheath lang natin, okay, kasama dyan, si femoral artery, okay, which occupies the lateral part or lateral compartment. Okay, si femoral vein, which occupies the intermediate compartment. Okay, and your lymph vessels, okay, which occupies the medial compartment. Okay, your medial compartment is also the femoral canal. Okay, so your femoral, that is your femoral sheath. Okay, so sa femoral triangle, navel, no? Sa femoral sheath, in-exclude si nerve, hindi sinama. So, artery, vein, and lymph vessels na lang. Okay? In your medial compartment, okay, that is also known as the femoral canal. Okay? At the upper end ng femoral canal, nandoon si femoral ring. Okay? Si femoral ring. Okay? It is filled by a plug of extraperitoneal fat called the femoral septum. Okay? So basically, dyan nangyayari yung hernia, no, sa femoral ring. Femoral hernia, dyan siya pumapasok. Okay? So your femoral ring, okay, the boundaries include, ito ang femoral sheath, Ito ang femoral sheath. This is your artery, this is your vein, this is your lymph vessels. Okay? So nandito yung medial compartment, so this is your femoral canal. Tama? Okay? So, ano daw ang sa upper end ng femoral canal, 'di ba? Nandun ang femoral ring. Okay? So, basically nandito ang pinag-usapan natin. Okay? So, anteriorly, sino ang nandyan? Okay? So, this one, no? An inguinal ligament. Okay? Posteriorly, this is the pectineus and the pubis. Okay? Laterally, ito, no? Andito ang femoral vein. And medially, nandun ang lacunar ligament. Okay, so those are the boundaries of your femoral ring. Okay, so nakatapos na tayo. Femoral triangle, femoral canal, femoral sheath, femoral ring. Ano ang next na dadaanan ni femoral artery? Okay, so nandito galing si femoral artery, susuot siya sa loob, tama? So, nandun siya ngayon sa ilalim ni sartorius. Kaya siya subsartorial canal. Okay? So, si femoral ring ay doon papasok. Ay, si femoral artery, no, ay doon papasok. Okay? So, the adductor canal or subsartorial canal, okay, is the apex of the femoral triangle. So, andun, no? Nandito siya sa ilalim. Okay? So, what are the boundaries? Okay, anteromedial, ito, no? Sartorius. Laterally, wala dito. The vastus medialis. Okay? The posterior, ito, no? The adductor longus and magnus. Okay? So, what are the contents? Andun pa rin si femoral artery, si femoral vein. Tama? Ano pa siya? Andun pa rin ang deep lymph vessels. Okay? However, wala ka ng femoral nerve, no? Hindi na siya femoral nerve, no? Hindi na nag-continue. Okay? Yung femoral nerve mo, branches na lang. Okay? Which is your saphenous nerve and yung nerve to vastus medialis. Okay? Yun lang ang nag-continue sa adductor canal. Okay? To sum it up, okay, your femoral triangle will contain navel, nerve, artery, vein, lymph vessels. Sa femoral sheath, hindi sinali si nerve, no? AVL na lang. Artery, vein, lymph vessels. Ang pumasok sa adductor canal, si artery, vein, lymph vessels. Hindi ulit sumali si nerve, no? Femoral nerve. Pero nandun na yung branches. Saphenous nerve and nerve to vastus medialis. Okay? And sa femoral canal, okay, lymph vessels lang ang nandun, okay, as well as the femoral ring. Okay? So, that's the summary of your femoral everything, no? Lahat ng femoral. Okay? Lahat ng pinagdaanan ni femoral. Okay? Okay, now let's go to the last part of your handout. Okay? Last portion, no, of this lecture. Okay? So, let's discuss the back. Okay? So, the back, okay? So, we'll start with the bones. Okay? Your vertebral column. Okay, your vertebral column is composed of 33 vertebrae. Okay? When you were a child, okay? 33 vertebrae. So that will be 7 cervical, 12 thoracic, 5 lumbar, okay? And 5 sacral and 4 coccygeal, okay? 7, 12, 5, 5, 4. Okay? However, when you grow old, okay, mag-fuse ang sacral into 1 and your coccygeal will fuse into 1 as well. Okay? So, it functions to protect your spinal cord. Okay? It supports the weight. Okay? It allows the movement of the rib cage for respiration by articulating with the ribs. Okay? So, initially, you have a primary curvature. Okay? In your vertebral column. Okay? The primary curvature, okay, they develop during embryonic and fetal periods. Okay? So, initially, ito yung nakikita natin. Kaya siya primary curvature. Okay? So, remember, during fetal position, nakayukot ka, di ba? No? So, the curvatures that we can see are the thoracic curvature and your sacral curvature. Okay? In the sacral regions. However, as you grow old after birth and during infancy, no, as you learn to control your head, no, nagkaka-head control, and as you learn to walk, stand, okay, you will develop secondary curvatures, okay, which are your cervical and lumbar curvatures. Okay, so lordosis. So the primary curvatures are kyphosis. The secondary curvatures are lordosis. Okay, now let's talk about the intervertebral disc. Okay, so between each bone, between each vertebra, okay, we can see an intervertebral disc. Okay, it actually comprises the 25% or 1/4 of your height. Okay, however, in atlantoaxial joint, so between C1 and C2, absent, no, ang IV disc. Okay, absent ang IV disc. So your IV disc consists of a nucleus pulposus, okay, internally or centrally, okay, and annulus fibrosus externally. Okay? So, it retains the nucleus pulposus and permits a limited amount of movement. Okay? Para siyang cartilage, no? It is avascular. Okay? Pero yung peripheries, okay, it is vascular. Okay? Your IV disc will allow limited movement, okay? At the same time, shock absorber. Okay? So, para siyang dulce de leche ba yun? Na cake, no? So, yung sa loob is the nucleus pulposus, while the outside is your annulus fibrosus. Your nucleus pulposus will prevent compression. Your annulus will prevent stretch tension. Okay? So, in terms of bones, okay, you can categorize them to typical and atypical. Okay? So, this will be the characteristics of a typical vertebra. Typical. Okay? So, a typical vertebra has a body, okay, which is the anterior part. You have a vertebral arch, okay, with pedicles and lamina, and it should have a spinous process, 2 transverse processes, and 4 articular processes. For example, in here, this is an example of a lumbar vertebra. So you should have a body, and then you should have a vertebral arch, so posterior. So meron kang spinous process, dalawang transverse process, okay, and a superior and inferior articular processes, no, marami. You also should have a vertebral foramen, okay? So your vertebral foramen protects the spinal cord, okay? Pag pinagsama-sama mo yung vertebral foramen ng lahat ng vertebra, it will form the vertebral canal. Okay? You also have a vertebral notch, okay? And then pag pinagsama-sama mo, okay, it will form intervertebral foramen. Okay, your intervertebral foramen, on the other hand, will transmit the spinal nerves. Okay? So, remember, vertebral foramen, spinal cord. Intervertebral foramen, spinal nerves. You also have a transverse foramen, okay, which will transmit the vertebral artery, veins, and some autonomic nerves. Okay? However, si C7, the foramen is too small, okay? Hindi nagpa-pass through si vertebral artery. Okay, so you have a vertebral foramen in here. Okay, so this is where your spinal cord is located. Okay, so regionally, there are differences, okay, between cervical, thoracic, and lumbar. Okay, so for your cervical, okay, in terms of the spinous process, it is small and bifid, no? So dalawa ang dulo. Okay, dalawa ang dulo ng spinous process. Okay, your thoracic, it is long and inclined downward. Okay, while your lumbar, it is short, flat, quadrangular, and projects posteriorly. Okay, so this is, yan. So, long and downward itong thoracic. Okay, your cervical, bifid, no, ang spinous process. Okay. Your transverse process, okay, in your cervical part, meron kang foramen transversarium. So, dyan nagpa-pass through yung vertebral artery, no? Sa thoracic part, meron kang costal facet, no? Kasi mag-articulate dyan ang ribs, no? To form your costo-transverse process. Okay? In your body of the vertebra, sa cervical, it is small and broad side to side. Okay? While in your thoracic, it is medium in size. Okay? And it is heart-shaped. Okay? I remember it, okay, because sa thoracic, di ba, thoracic area, nandun ang heart, no? Nandun ang heart. And it also has costal facet, no, to form your costovertebral joints. Okay, in your lumbar region, ang body naman is kidney shape, no? Kidney shape. Okay? Paano ko siya naaalala? Kasi nasa lumbar region, di ba, ang kidneys, no? So, kidney shape. Okay? So, your vertebral foramen, it is large in your cervical region, no? It is large in your cervical region because meron kang cervical enlargement ng spinal cord, no? At that region, no? Because maraming sinusuplayan na plexus, di ba, ang cervical part. So, dapat malaki ang butas dyan. Okay? So, thoracic, wala masyadong mga plexus, kaya maliit lang ang vertebral foramen. Okay? And sa lumbar, triangular in shape. Okay? Sa lumbar region din, makikita ang mammillary processes and accessory processes. Okay? Ayan, wala siya dito, no? So, now this is your atypical, yung hindi typical vertebra. Okay? To start with your C1, okay? Or your atlas. Okay? Bakit siya atypical? Wala siyang body, wala siyang spinous process, no? It is the widest cervical vertebra. Okay? Wala siyang body, wala siyang spinous process, pero meron siyang anterior arch and posterior arch. Okay? And it also has two lateral masses, no? So this will receive your occipital condyles, no, to form your atlanto-occipital joint. Okay, next, no? You also have C2 or your axis, no, which is C2 or axis, no, which has, no, an odontoid process or dens. Okay? So, kaya siya atypical, meron siyang ganyan. Okay? Meron siyang antenna. Okay? So, it projects from the superior surface of the body. Okay? And has a small transverse process. Okay? Next is your C7 or your vertebra prominence. Okay? It has the longest spinous process. Okay? And it is not bifid. Okay? So, hindi siya bifid. Parang katulad na siya ng thoracic vertebra. Okay? It has a large transverse process, pero yung butas, maliit. No? Small foramen transversarium. Kaya yung vertebral artery, hindi makapasok. Okay? And lastly, no, yung sacrum. Ay, hindi pala last, no? Your sacrum naman, okay, it is consists of a 5 rudimentary vertebra and it is concave anteriorly. No? It will articulate with L5 to form your lumbosacral joint. Okay? It will articulate with the coccyx, no, to form your sacrococcygeal joint. Okay? And it will articulate with the two iliac bones to form your sacroiliac joint. Okay? Now, okay, sa coccyx naman, okay, these are 4 bones, no, initially, which eventually fuse together, no, as you age. Okay? And it provides attachments for the coccygeus and levator ani muscles. Okay? So now, let's go to the ligaments of the vertebral column. Okay, your ligaments, ito madalas naman ito itanong ng mga anes, no? So, pag spinal anesthesia, no, anong mga layers, no, ang nadadaanan ng iyong needle. Okay? So, you have an anterior longitudinal ligament. Okay? So, it runs at from the skull to the sacrum, and it occupies the anterior surface of the vertebral bodies and IV disc. Okay? Dahil nasa anterior siya, it will limit extension. Okay? It is also wide and strongly attached sa front and side. So, well protected ang front and sides, no, ng vertebral bodies and IV disc. On the other hand, your posterior longitudinal ligaments, okay, it is located posterior to the vertebral bodies and IV disc, okay, and it will limit flexion. Okay, however, this time, it is weak and narrow. Kaya, wala masyadong support, no, yung IV disc mo posteriorly. Kaya ang usual location ng IV disc herniation is posterior. Specifically posterolateral, no? Kasi wala masyadong support posteriorly. You also have ligamentum flavum, okay, which will connect the lamina to lamina. Okay? So this is your anterior longitudinal ligament. Ayan, this is your posterior longitudinal ligament. This is your ligamentum flavum. Okay? This is your ALL. This is your PLL. This is your ligamentum flavum. Okay? So your ligaments, other ligaments, ligamentum nochae, okay, it is triangular shape, no, at the posterior aspect of the neck. Okay? It is a thickening and a continuation of supraspinous and interspinous ligament. Okay? Your interspinous, it will connect two adjacent spinous processes. Your intertransverse, it will connect two adjacent transverse processes. While your supraspinous will connect the tips of the adjacent spinous processes. So, your supraspinous is here. Okay, ayan, spinous processes. Your interspinous is here. Okay, so yeah. Okay, so let's go to the muscles of the back. Okay, so your muscles of the back is divided into three groups. Okay, you have superficial, intermediate, and deep or post-vertebral muscles. Your superficial, okay, are also the muscles of your shoulder girdle. While your intermediate, okay, are the muscles that are connected to your thoracic cage. Okay? While your deep muscles or post-vertebral muscles are exclusively belonging to the vertebral column. Okay? So your deep muscles are still further divided into three: the superficial, intermediate, and the deepest. Okay? So mainly they provide the postural tone, no? That's their main function, no? To maintain the body erect. Okay? It was asked before, no? So what are the function of your erector spinae? Okay? It functions to maintain the body erect, no? Postural tone. So the superficial vertically running muscles are your erector spinae, okay, which include iliocostalis, spinalis, and longissimus. Okay? Your intermediate oblique running muscles are your transversospinalis, which includes your semispinalis, multifidus, and rotatores. Okay, while your deepest muscles are your interspinalis and intertransversari. Okay? So now, let's go to the spinal cord. Okay? So your spinal cord is a cylindrical grayish-white structure. Okay? It will start at the medulla, no? At the end of the medulla oblongata of the brain. Okay? At the foramen magnum. It only occupies, no, the upper two-thirds, no? So nag-end siya. Hindi, it will not occupy the whole vertebral column. Okay? And internally, it is gray matter. Externally, it is white matter. In contrast to your cerebral hemisphere, no? Your cerebrum is gray matter outside, white matter inside. Okay? So the termination is different in adults and in children. Okay? So in adults, it ends at the lower border of L1, while in children, it ends at the upper border of L3. Okay? It has fusiform enlargement, okay, at the cervical and lumbar region because, okay, diyan nagpo-form, di ba, ang mga plexus. Okay? So it is enlarged at those areas. So inferiorly, okay, it will taper, okay? It will be a cone shape, no? Kaya ang term is conus medullaris. Okay? So now let's go to the coverings of your spinal cord, okay? So to start, okay, you have the dura mater. Okay, it is a tough fibrous outermost layer. Outside is the subdural space. Okay, and then below it is the subdural space, and more external to the dura mater is the epidural space. Okay, which will contain the internal vertebral venous plexus. Okay, and the middle meningeal artery. Okay, that's why injury to the middle meningeal arteries will cause epidural hemorrhage or epidural hematoma. Okay? So, the dura mater is the most external. It is followed by the arachnoid mater. Okay? It is a filmy, transparent, spidery layer. Okay? And beneath it is the subarachnoid space, okay, which will contain the cerebrospinal fluid. Okay, your subarachnoid space will end at the level of S2. Okay, at the level of S2. Paano daw matatandaan? Subarachnoid space, no? Dalawa ang S, no? Dalawa ang S. So, S2. Okay, so yan ang end ng subarachnoid space. Okay? And the most internal layer is your pia mater, okay, which is the innermost meningeal layer. It is closely applied to the spinal cord, okay, and meshes the blood vessels to the surfaces of the spinal cord. Okay? Your pia mater has several continuations, okay? Inferiorly, okay, the prolongation of the pia mater, okay, of the spinal cord at the level of L2, okay, for which, okay, the conus medullaris will be attached to the coccyx, no? So, si pia mater hindi sumusuko. A-attach pa siya sa dulo, no? So, attach siya sa dulo, sa coccyx to the conus medullaris. Okay? So, that is known as the filum terminale. So, the continuation of pia mater from the conus to the coccyx. So, that's filum terminale. Laterally, magko-continue din ang pia mater, no? It will continue as lateral extensions, okay, consisting of 21 pairs of toothpick-like processes, okay? So, andito, no, laterally, these are continuation of pia mater. Okay? So, those are your denticulate ligament. Okay? Those are your denticulate ligament. Okay? And it functions to hold your spinal cord in position. Okay? Next to discuss is your spinal nerve. Okay? You have 31 pairs of spinal nerves. Okay? So, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 1 coccygeal. Okay? You have 8 cervical, no? In contrast to your vertebra, you only have 7, no? So, ito ang nabago. Okay? So, they are formed in the intervertebral foramen. Okay? Wherein, you have a dorsal rami. Okay? So, your dorsal ramus will innervate the skin and deep muscles of the back. Okay? In your ventral ramus, yung mga lagi natin binabanggit kanina, it will form the plexus. Okay? So, your C1 to C4 will form the cervical plexus. Your C5 to T1 will form the brachial plexus. Okay? Your T1 to T11 will be the intercostal nerves. Your T12 will be the subcostal nerves. Okay? And then your L1 to L4 will form the lumbar plexus. And your L4 to L4 to S4 will form the sacral plexus. Okay? So yun ang contribution, no, ng ventral rami. Okay? Sabi natin, your spinal cord will end at the lower border of L1 in adults, no? However, yung spinal nerves continue to exit, no, kahit wala ng spinal cord doon. Okay? So it appears like a horse tail, no? It appears like a horse tail. Okay? So that is the literal meaning of your coda equina. It is formed by the great lash of dorsal nerve roots of the lumbar and sacral spinal nerve that surround the filum terminale. Okay, so this is your coda equina. Yan, parang horse tail. Okay? So next, okay? So you should also get familiarized with the dermatomes and the myotomes. Okay? A dermatome is an area of the skin innervated by the sensory axon within each nerve, no? While your myotome is the collection of muscles innervated by a single nerve root. Okay? So, this time, okay, actually, no, this is actually for memorization, no? Pero, ayan, let's enumerate na lang, no? So, your C2, occipital, hawakan nyo, no, habang sinasabi ko, no? C2 is occipital protuberance. C3, supraclavicular fossa. C4, acromioclavicular joint. Okay? C5, lateral elbow. C6, the thumb. C7, the middle finger. C8, the little finger. T1 is the medial elbow. Okay? Your T2, axilla. The T4 nipples. Okay? Your T6 is your ciphisternum. Then T10, umbilicus. Okay? Followed by your T12, no? Inguinal ligament. Okay, hawakan nyo lang din. Your L2 is your anteromedial thigh. Your L3 is the medial knee. Okay? Your L4, medial malleolus. Okay? L5 is the third MTP. Todo hawak talaga ako, no? Hindi nyo naman nakita. Your S1 is the lateral malleolus. Okay? Your S2, popliteal fossa. And your S3 is ischial tuberosity. And S4, S5 is the perianal area. O, wag na hawakan. Okay? While your myotomes, okay, is represented by a muscle or a group of muscle. Okay? Your C5 is elbow flexion. C6, wrist extension. C7, elbow extension. C8, finger flexion. T1, finger abduction. Okay? While your L2, okay, hip flexion. Okay, pwede nyo gawin. L3 is knee extension. L4, okay, is ankle dorsiflexion. Okay, L5 is big toe extension and S1 is ankle plantar flexion. Okay, so that is the summary. Okay, this table, this is directly lifted, no, from Snell. Okay, so those are the important dermatomes and myotomes in your body. Okay, and that ends your Genesis anatomy. Okay, thank you for listening. Okay, and okay, good luck and see you in the Top Notch program proper. Okay, thank you.